In this video, we'll be talking about how to read the product label. Before we begin, it might be helpful to use the Navigating the Skincare Aisle tool to help you identify what ingredients, concentrations, and dosage forms might be most helpful for meeting your skincare needs. This way, you'll know what to look for when reading the product label. Product information can be located on product packaging, such as the plastic or box the product comes in, or on the product container itself. The first thing to look for is the list of ingredients. Some products may have an active ingredient, which is usually found in the front of the product packaging underneath the brand name, or at the top of the drug facts table. Some products will have an active ingredient list along with an inactive ingredient list. Other products will just have a general list of ingredients. Skincare products may contain moisturizing ingredients such as glycerin, mineral oil, lanolin, dimethicone, or petroleum. If your skin is sensitive to fragrances or dyes, check the ingredient list to ensure these are not included in your selected product. If your selected product contains an active ingredient, pay attention to the strength or concentration of the ingredient. This is usually presented as a percentage. Lower strengths are generally better for use on sensitive areas such as the face, genitals, and skin folds. Higher strengths may be used on other areas of the body and extremities. Talk with your pharmacist or doctor if you are unsure of what strength to use. If your selected product contains an ingredient list, pay attention to the order of the ingredients. Like a food label, ingredients are listed from highest to lowest concentration. The next thing to find on the product label is the dosage form. Some examples of different dosage forms include creams, ointments, sprays, foams, shampoos, gels, or lotions. These vary in consistency, greasiness, and speed of absorption. Some dosage forms are better for covering large areas of skin, while others are better for small areas or for areas with hair. For more information about the differences between these dosage forms, check out the table on our website. Next, look for the directions. The directions will explain how the product should be used. Most product labels contain general directions for use. For more specific directions on how to use the product, talk with your doctor or pharmacist. Warnings are another important piece of information to look for on a product label. The warning section may contain information about product safety and may list certain populations or groups that should avoid using the product. If you have any questions about the information provided in this section, talk with your doctor or pharmacist. Some over-the-counter products will contain a description of the product's indication, purpose, or uses. This can be helpful for finding a product that addresses your specific symptoms. Whenever looking at a product label, look for the expiry date and note the expiration date after opening. The hourglass symbol is something used to identify the expiration date or best before date. If just the month and year are shown, this means the product expires on the last day of the indicated month. The open jar symbol tells you how long a product is good for once it has been opened. For example, the jar with the 3M on it means the product expires 3 months after opening. To ensure your product retains its efficacy until the expiration date, make sure to follow any storage instructions listed on the bottle. The last thing to note on the product label is the quantity or package size. Check how much product comes in each package to make sure you have enough to treat the affected area for the duration of your treatment, and help you discern the price across similar products. In summary, reading a product label involves finding the ingredient list, strength, dosage form, directions, warnings, uses, expiration date, and quantity. If you ever have trouble finding the information on your product label, or have questions about what product is best for your needs, please talk to your doctor or pharmacist.